The reality is what really shows benefit for fall prevention is strength training and balance training.
Hello and welcome to Senior Life Publications Ask the Expert podcast, where we talk about all things involving healthcare, finances, free resources, and other senior-related topics. Hi, I'm David Moss, publisher of Senior Life Publications, which is a free resource that you can find throughout the Tampa Bay market.
And I'm Stephen Halstead, sales manager for Senior Life Publications. We're happy to be back again. I just want to make sure you understand you can get this magazine mailed right to you. It's a free publication. We can mail it to you. Give us a call. We'll get you on our mailing list every month. The magazine comes out. You can also pick it up around town at your local libraries, your village inns, and senior centers, and as well as other places around town. But anyway, we are here. Let's get to it, because we have with us today Dr. Amber Stevens with Optum here in Dunedin. Welcome.
Thank you.
So we're always excited to talk to our Optum doctors. So tell us a little bit about who you are and what you do.
So I am a family medicine physician. I have actually been with Optum for the last 3 years. Actually just celebrated an anniversary with the company, so that's very exciting. I love working here. Love working in Dunedin. I'm relatively local. I've been working in Pinellas County as a physician since 2005 and actually did my training at Bayfront for family medicine. So been around for a while, know a lot of the folks in the area, and have really seen the area grow and change and evolve over the years. So it's been good.
Congratulations.
Yes, thank you.
And that's great, because it's hard to find a doctor sometimes that is local. So a lot of people like that. So I actually had a question that I wanted to propose to you about fall prevention, because I know that's something we're always talking about, whether you're healthy, active, not healthy, inactive. But, have you seen, or what has your experience been like, even coming out of the pandemic? What was it like? Were you dealing with a lot of falls, or where are we at with that?
Yeah, well, I mean, dealing with falls is something that, we as physicians don't ever want to have to deal with, because huge amount of morbidity and mortality related with falls, especially in our older population. And obviously in Florida, we have a substantially older population. So we truly, I think, see a disproportionate amount of falls here in the state as compared to even some other states in the area or in the country in general. That goes along with a lot of the other health issues we see in Florida. We just have a little older population. So especially as our baby boomers get a little older, this is going to continue to be a bigger problem. The statistics go, 1 in 4 Americans will experience a fall during their lifetime. 30% of those falls will result in serious injuries, fractures. If you sustain a hip fracture, it's been said over and over, about 50% of those patients will pass away in the next 5 years. So a lot of morbidity, a lot of mortality associated with just, quality of life and providing care to patients. And truly, it affects the patients ultimately, because, you have someone who is very independent and all of a sudden now they're not. It's a big deal.
It is a big deal, and I, being a certified senior advisor and having worked with families closely, they say, well, we don't want mom to fall because we don't want her to go to assisted living. And it's like, well, that's not your goal for not falling.
Right.
We don't want mom to fall because...
Exactly.
Correct. Yes. And I think that a lot of people just, you see these commercials for, there's nothing absolutely wrong with First Alert or those things.
Right.
But it's like, this kept me from going to assisted living. Okay, let's just try not to fall, right?
Yeah.
So what causes falls in the first place?
So the number one risk factor for a fall truly is a previous fall, which sounds kind of cheesy, but once your balance is a problem, it's a problem. So if you fall, chances are it's going to happen again. Other risk factors, some disease processes, people have movement disorders like Parkinson's, where they naturally shuffle their feet a little bit more, people with chronic pain who their mobility is a little impaired. Anybody using walkers, canes, those can all be hazards as well as helps if they're not being used appropriately. Even people can fall out of wheelchairs if they're not using a wheelchair appropriately.
That's true.
And still get seriously injured, even though it's maybe not quite as high up in the air. those are some of the bigger risk factors that patients can really work on themselves in some ways. But also, even from a medical standpoint, if our patients are taking too many medications, there's drug interactions, that can cause a lot of complications too. And so, definitely always encouraging patients, asking their doctors, hey, what can I get off of anything?
Where are we at?
Where are we at? And sometimes the answer is no, we really can't stop anything. Sometimes the answer is let's be really careful with these 2 medications. But sometimes the answer is, hey, you're 85 years old, you don't need this anymore. Right. We're not trying to prevent the next 10-year mortality rate for you because chances are you may not have that long anyway, So, and that's just statistics, and that's always an individual discussion with the patient and their doctor. Everyone's got different life goals, different plans, different genetics. So you've got to really sit down and look at all those cases one by one. But those are your biggest risk factors, truly. Strength, mobility, and just, general, can you get around your house without having a fall?
And we want people to stay home, of course.
As independent as possible.
Absolutely.
Well, I picked up some other things you talked about, Dr. Stevens, with especially medical things to prevention, especially with their drugs that they do take that are prescribed by their doctor. You see that's really something that's happening a lot lately. If they cut down on those, or kind of sensory, or as it kind of makes them a little bit off.
Yeah, so some medicines, especially if people are taking pain medications, they can affect balance and even just consciousness. If you have someone who's a little sedated and then they're taking a pain medicine, and then they're taking an anti-seizure drug for whatever reason.
So the equilibrium's,
the equilibrium can really get thrown off from that. The average senior adult takes 8 pills. Okay.
Yeah.
So after you hit about 5 to 8 medicines, they're gonna start interacting. So you're constantly fighting. I mean, even today I had a patient who called complaining that she's like, well, you gave me a medicine that interacts with this other medicine. I'm like, yeah, you take 10 pills. It's gonna happen. And you have to be careful about that. And hopefully, as a physician, I make a point to try to always be aware of what I'm doing, but hopefully everybody's doing that as well. Like that would be a goal. So
that would be a goal.
We'll talk about prevention. What are some resources that some of the seniors that you come in contact, because it is about education, that they can find out there, not just with their doctor, but some other things. Since we are a senior populated area in the Tampa Bay market, is there some other resources that are out there for seniors to look at?
So the first thing I would say is make sure that you tell your physician if you've had a fall. Okay. Less than 50% of patients actually tell their doctors if they've fallen. And I can't prevent future falls if I don't know it's a problem. Okay. I do not have ESP. I don't know things if you don't tell me. Okay. It's a conversation I have every day with at least one patient. Okay. So if you tell your physician ahead of time that you have fallen at least once, well, now we can step back and go, okay, so what's going on? Is it an environmental thing? Like you have throw rugs in your home and we need to get rid of them? Is it you need grab bars in your shower? Is it, no, you really should be using a walker or a cane? Or perhaps it's just, you've got some weakness that I didn't realize you had because we've never had this conversation before. Right. And what you really need is a strengthening program. So there's ways to look at that. It really is a multifactorial approach in figuring out what the issue is. Now, if you've never had a fall, fantastic. Okay, let's try and keep it that way.
Right.
Things that you can do as an individual to prevent your falls. Okay, one, like I said, talk to your doctor about your medications. If you're taking lots of meds, let's figure out what's going on. Make sure this isn't going to be a problem down the line. The other issue is make sure that you're being preventative in your physical status. So I have a lot of patients, they love to go walking, they like to bicycle, and that's fantastic and ultimately is great. But the reality is what really shows benefit for fall prevention is strength training and balance training.
Right.
So most of my patients have access to local health gyms and through their insurance companies. And I tell them take advantage of those because those places all hold classes that will teach you strength and teach you balance and help you develop those skills. And that's ultimately what's going to keep you from falling. Because if you do have a trip, what catches you? You've got to be able to catch yourself. You've got to be able to stop it and be strong enough to catch it. You've got to be able to have the balance to keep yourself on your feet if you start to sway a little bit. And that comes from training. And it doesn't have to be crazy. I think some people, they think, and I say the word strength training, and I think in their mind, they're popping in Arnold Schwarzenegger and they're going, I'm never going to do that. I'm 80 years old. And I'm
That's
going,
not what we're
that's
talking
not
about.
what I'm talking about.
Yeah.
I'm talking about 1 pound dumbbells. I'm talking about practicing standing on 1 foot, all supervised, like within the confines of a safe environment where you can get stronger. Tai Chi is fantastic for that. And there's lots of locations, within Pinellas County that offer Tai Chi. And it is fantastic for fall prevention because it helps with strength and balance. Yoga is great for similar reasons. And you can find yoga everywhere. So, and that's the other thing. I say yoga, and patients, I think they're thinking the pretzels. And I'm like, that's not what it's about.
Legs
And
behind the
there's-
heads,
Yeah, and there's also chair yoga. And
Yes.
chair, it depends. There's different levels of stuff, so people shouldn't be embarrassed.
Absolutely.
You just brought up 2 major points during our discussion that I think are very important to point out. One is once someone falls, they can be embarrassed by that, so then they don't tell someone, which leads to the second one, which is they don't tell someone.
Right.
So we just want people to understand that don't be embarrassed. Look, I'm 53 years old. My balance is not what it used to be, and I find myself a little off balance. I haven't fallen, but I need to be aware of that, right? It's about being aware and doing those things. So, and you guys have offered throughout the last year online classes. As a matter of fact, if you look into our magazine here, Optum does have their schedule online events. You also, they're free.
Yep.
You don't have to even use the doctor's office to use
No,
to
you
go
do
on
not.
there. And you can go to florida.optum.com/events. Look at that calendar, do them from home. Obviously, they can reach out to somebody in one of the
Just
offices.
pick up a free publication.
And pick up the publication
Yep.
because it's in there as well.
Well, I love the interaction that you have, not just talking to you, Dr. Stevens, and all the other doctors that are on Optum's list, but also the interactions. You are providing classes. You are providing interaction with all the different skills that you just talked about. So all the different things that you guys provide, it's a really great resource for our seniors. It is really helpful for us to know that you guys are out there doing these different things. And preventive measures are
Well,
now more
that's
than ever
really where
important.
it's at.
Yeah.
If you can't, we shouldn't be on the back end playing catch up. We should be preventing these things from the beginning. I don't want to spend my senior years disabled because I had a fall because I didn't preventively address that. I noticed even, by personal journey, 5-6 years ago, I realized I was starting to have some issues, and I'm not very elderly, and I'm 42 if you want to know. But I realized a few years ago I really wanted to make some changes, and I had developed a stress fracture. My balance wasn't as good. I was actually a lot heavier, and decided that wasn't what I wanted.
Right.
And so I started making some changes, and it started slow. But one of the things that has made such a huge change is that strength training. My balance is better. I have substantially less pain, and I want to go into my senior years feeling good, and that was my goal. And that can start at any point in time. You don't have to worry. Oh my gosh, I made it to my 70s, and it's too late. Nope, it's never too
Preventative
late.
It's all done.
maintenance.
Any
all
point
the
in
way.
time you can get
During the
rolling.
time. Yeah.
Yeah.
Well, Dr. Stevens, thank you so much. Always a pleasure to see you, and good information. We appreciate
Yeah,
you
that was
being-
one of our best interviews I think we had. Sorry, Dr. Hiltz, but
Gotcha.
no competition. But if you'd like to see this and more information, please go to our podcast called Ask the Expert, or you can get a free publication. You can contact me. My name is David Moss. I'm the publisher of Senior Life Publications. My email is D as in David, Moss, M-O-S-S, at seniorlifepublications.com. Or you could contact me directly on my cell phone number, 727-430-5180. You can also pick up a hard copy at any Village Inn restaurants in Pinellas County. I hope you enjoyed this free resource on Ask the Expert, and we'll see you next time on our new podcast channel. Have a great day.
Bye.